Here we have the scapula again. This is the anterior side. This is a left shoulder. The humerus would be here. And we have the clavicle up here. So on the scapula, on the anterior side, we have the subscapular fossa. We have the coracoid process. And we can see the acromion here, which attaches to the clavicle. As far as the clavicle, we have the sternal end here, which attaches to the sternum. We have the acromial end attaching to the acromion. And we can see the inferior angle, this corner here, and superior angle. The medial border, or the vertebral border. The lateral border or axillary border. And as we turn for a lateral view, we can see the glenoid fossa, so the depression in here where the humerus sits. We have the infraglenoid tubercle here at the bottom and the supraglenoid tubercle at the top of that joint surface. And as we look posteriorly, we have the scapula with the lateral border, the axillary border, the inferior angle, the medial border or vertebral border, and superior angle. The primary structure we'll palpate is the spine of the scapula, and below that is the root of the scapula. So deep to that spine is the root of the scapula. The spine of the scapula travels out laterally, which forms then the acromion. Below the spine of the scapula, we have the infraspinous fossa, and above the spine of the scapula, we have the supraspinous fossa. So for each of these fossae, the infraspinous fossa, the rotator cuff muscles stand there. So infraspinatus is in the infraspinous fossa, supraspinatus is in the supraspinous fossa, and then back to the anterior side, we have subscapularis muscle in the subscapular fossa.